Hi guys, Dr Dona, Specialist Plastic Surgeon. This is part 3 of my series of breast lift surgery videos. In this video I'm going to talk about breast lift augmentation surgery. Now, combined breast lift augmentation surgery, which means performing a breast lift and inserting implants during that same operation, is far more complex than either one of those procedures done separately. It is considered to be the most difficult of all cosmetic breast surgery procedures performed, and because of this, many plastic surgeons choose to not do them. And while some are much easier than others, in general they are extremely challenging. So prior to undergoing surgery, patients need to be made aware of the complexity of this combination procedure. They need to have realistic expectations and understand that additional surgery, along with additional recovery time, time off work, stress, expenses, etc., may be necessary in the short or long term. So why is it so complex? Well, there are numerous things that a surgeon must, or at least should, assess and consider before contemplating and planning a surgical breast lift with or without implants. Now, these issues were covered in a previous video, but just to revisit them briefly. They include skin quality, degree of sag, the nipple direction, the skin distance from the nipple to the lower breast fold, nipple areola size, breast tissue volume, breast tissue quality, how attached that breast tissue is from the chest wall muscles, the patient's desired look, and finally, time and how will that impact on the results. A concept that one needs to understand is that a breast lift augmentation surgery requires the surgeon to increase the breast size with breast implants, whilst at the same time reducing the breast envelope. That is, removing skin and breast tissue in order to achieve the breast lift. These two potentially counterproductive actions must be balanced as perfectly as possible in order to achieve the desired results. Ultimately, the surgeon needs to lift up the nipple and breast tissue to ensure a uniform and tight distribution of that natural breast tissue over the chosen implant to create a uniform appearing and feeling breast mound. Now, during the breast lift procedures, the nipple remains attached to the blood supply and nerve supply whilst they are lifted and repositioned. Now, some of the technical difficulties and limitations of a breast lift surgery is related to ensuring that you don't surgically completely cut off all the blood supply to the nipple, which would basically mean the nipple would literally die and fall off. Now, performing a breast lift without an implant allows the surgeon to apply more surgical maneuvers designed to lift up the breast tissue to maximize the chance of the breast tissue remaining high. Now, every surgical step involved in a breast lift does to some degree cut off part of the blood supply to the nipple. Now, when an implant is added to the equation, many of the steps involved in creating a pocket for the implant and the pressure effect from the implant further compromises the blood supply to the nipple. Therefore, the surgeon often needs to limit the maneuvers required to maximally lift that breast tissue. They also need to reduce the maximal size of the implant that could otherwise be used for a simple breast augmentation. Now, these limitations can add to the potential issue of the breast tissue resagging early after surgery. And the potential for resagging is even greater with breast tissue problems such as large volumes, breast tissue that is very soft and lost its elasticity, breast tissue that is detached from the underlying muscles and slides around, skin that is thin and that has lost its elasticity. So given that women wanting a breast lift typically have one or more of these problems, then you can appreciate that one of the main issues with a breast lift augmentation surgery is that the breast tissue doesn't stay where we want it to stay. Essentially, the patient is needing a breast lift because they have weak and soft breast tissue quality which is sagged. Yet that same breast tissue and skin still exist after surgery, and it's therefore still wanting to sag. No surgery and no surgeon can change the quality or consistency of the breast tissue and skin. All the surgeon can do is try to reposition and sculpt that breast tissue. And in addition to breast tissue that doesn't necessarily stay where it's meant to stay, breast implants don't necessarily stay where we wish they would. Therefore, breast implant related problems such as positioning issues, too low or lateral slide, etc., can occur and may be a reason for returning to the operating room for further surgery. And this is especially the case in those women needing breast lift because their breast tissue envelope is typically soft without any structural support, so it easily stretches again, resulting in a very mobile implant. In the end, often the full perky look that many women want is simply not achievable due to the person's chest wall shape, breast footprint, and the nature of that person's natural breast tissue. In the end, if you're needing a lift and want implants as well, there are two options that I may discuss with you. This could be either a combined breast lift augmentation or two separate operations. Now, these approaches were discussed in my previous video, but just quickly we'll revisit those now. Now, the single operation approach basically means having a combined breast lift and implants at the same time. Now, many variables are taken into account before I decide who is suitable for this, and it is decided on a case-by-case basis. However, as a very general guide, the ideal candidate for this is someone who has minimal breast tissue, mild to moderate sag, and still has relatively firm tissue and elasticity. However, even in the ideal candidate, I would quote about 20% chance of those patients requiring further surgery to fine-tune the results. Now, the two-stage or two-operation approach means performing a breast lift first and an augmentation as a second operation at a later date. This is the option taken for those when I believe it is too risky to attempt a combined lift augmentation. Who that may be is decided on a case-by-case basis, but generally speaking, the typical patient who is offered this option has significant sagging and/or has a large volume of soft breast tissue. Trying to do a lift and augment in one operation for this group of patients would be risky, as they have a significant chance, or a high chance rather, of significant potential complications and a much greater chance, more than 50%, of requiring further surgery. That is, whilst you could offer a single combined lift augmentation operation to this group of women, more often than not a second unplanned surgery is required to fix problems. So the rationale for a two-stage approach in such women is simple. A breast lift is designed to create an improved breast shape with the nipples sitting at the correct level. Then, approximately 6 months later, a well-planned breast augmentation is performed, as it is easier to make what is now a good breast shape into a bigger good breast shape. However, many patients don't proceed with this augmentation, as they are just happy to have a good breast shape. An important aspect of breast lift alone, however, is that such patients will most likely not achieve long-lasting upper pole fullness, as their breast tissue will settle into a lower position. Hence, most of these women do want augments to address this problem. Now, I will briefly mention here that upper pole fullness can also be achieved to a lesser degree with fat transfers, but that's a topic for another video. So basically, you opt to do two well-scheduled and well-planned operations. A lift first, then an augmentation later, to have the best chance of achieving a great long-term result. This is far better than doing one planned operation, a combined lift augmentation, where we have a high chance of needing further unplanned surgery to try to fix problems. Patients not happy, surgeons not happy, and we are less likely to get the best long-term outcome. Basically, we want to choose the best pathway, safest pathway, least potential problems pathway to achieve the best long-term result. And if that means two planned operations, then that's how it needs to be. And finally, with a two-stage approach, the surgeon could potentially use a much larger implant than is otherwise possible with a combined lift augmentation. Anyway, I hope these videos have shed some light on the complexity of breast lift surgery. In the end, do your homework, always consider second opinions, and if you want my opinion, give my office a call to schedule a one-on-one consultation with myself. Thanks for listening.